Welcome to page 95 of Anatomy Coloring Book, The Visual System. This is Dr. Stephen Harkins. This particular lesson deals with the fluids of the eye. First, the outer portion of the eye, the tears. Tears come from the lacrimal gland here in your superior lateral corner above your eyelid. And there are little ducts that your tears travel through. And these tears travel from this upper corner, lateral corner, across the eye. And they travel into these little lacrimal puncta, or little holes right here on the medial portion of the eye. And they travel through a little lacrimal canal here, here, and here. And then they into a lacrimal sac here before they drain into the nasolacrimal duct. Naso for nose, lacrimal for the tearing gland, and all the way into the inferior meatus of the nasal cavity, this area here. The tears are important to provide lubrication for the inner, in this area right here, what's called the conjunctiva, the nasal, or the conjunctiva. It's the layer, the thin layer on the outer portion of the eye, and the inner portion of the eyelids. It's called the conjunctiva. And it's important that these tears lubricate, and if there's any debris or infectious material or something, it can be moved out of the area and drained out through the nose. And this is why when you cry, you might need a tissue, because the tears drain through the nasolacrimal duct into the nose. There's also another source of tears, and it's this tarsal plate right here, a little gland that lies right in here that also supplies a little bit of tears inside the actual eyelid. The tears, the tearing, you can spontaneously, here is the lacrimal duct from this view here, by squeezing your eyeballs and your orbicularis oculi muscle, and squishing your eyes, you can use pressure to sort of force those tears. The pressure will have these tears come through the lacrimal ducts and into the conjunctival space as well. There's also fluid inside the eye. As you know, the vitreous humor inside here, inside the vitreous space here, but also that's the space here. This fluid creates a natural pressure, an outward pressure on the eye. It's called intraocular pressure. And in the space in front, in the aqueous space, where the aqueous humor lies, there's also fluid called the aqueous humor. And this fluid comes from a place called the ciliary body, the ciliary process of the ciliary body. Right here. This little gland produces this fluid for the aqueous chamber here, and this fluid comes out from behind the iris. Recall that the iris is this pigmented, we'll make it blue for blue eyes, and this is the area that makes up the color of your eyes. It opens and closes and lets more and less light in. But behind the eye is called the, or behind the iris is what's known as the posterior chamber. It's this area behind the iris. And it's the area that the aqueous humor comes from the ciliary body and exits out of into the anterior chamber. This is the anterior chamber of the aqueous space. And the drainage spot is called, where the aqueous humor drains, is called the canal of Schlemm. And it's attached to a vein, the canal of Schlemm here is attached to the vein here that takes this fluid outward. If there's any blockage right here, any blockage, it can create extra pressure. The aqueous fluid will start to build up. The aqueous humor will start to build up here and create pressure everywhere in the anterior chamber, posterior chamber, but in the aqueous area, even pushing back on the iris, or excuse me, the lens, and creating pressure, more pressure, greater pressure here in the vitreous space. And this is called glaucoma. Or more accurately, high pressure in the eyes can cause glaucoma. And this has been page 95 of Anatomy Coloring Book, Visual System, Part 2, and this is Dr. Stephen Harkins.